Knock, knock. Hello, I'm Brennan. I'm gonna be your nurse today. Can I get your name and date of birth? So I ask them their name and date of birth. I'm gonna check their wristband, make sure that the names match. Then I'm gonna wash my hands. I'm gonna ask if they have any allergies. I'm gonna check the system, make sure they don't have any allergies in there. And then I'm just gonna explain the procedure. I'm gonna let them know that we're gonna be placing a catheter, that we're gonna do some perineal care before and after. So I'm gonna put on some gloves to start doing that. Then I'm gonna make sure that there's a doctor order in for the catheter. Okay. I'm gonna try to give them as much privacy as possible. Put a towel there. Then I got a basin ready to go. Okay. So I have one dry cloth, one wet one. Pat dry. So I'm done with that. Remove the gloves. Then I'll wash my hands again. Now I'll start getting things ready for the catheter. So I have something to throw everything away into. Okay. Then I got everything else ready to go. Probably should wash my hands after dealing with that. Okay, so now throw that away. Try not to have anything touch the top surface. Okay. Put on the sterile gloves. Touch anything else with my hands. Try not to touch anything. Just set that there. Okay, so let's just start getting everything ready. I'm gonna put iodine on my cotton balls. That to the side for now. Then I'll get my lubricant. the side, try not to touch anything. Okay. Try to stay away from the borders. Okay. You can put the syringe in. Sheath the catheter, trying not to touch anything. Okay. Now I'll lubricate the catheter up. Everything over to where the no sterile field is. So again, try not to touch anything on my gloves. Okay. Now I'll clean the meatus. One cotton ball, try not to touch anything. Touch it with only the cotton ball. I'll do one side. Other side. Now I can throw this away. Now I can insert the catheter. I'll push the catheter in until I see urine present. And I'll push it in 1 to 2 inches past that. I'll hold it with my non-dominant hand, and then I'll fill the balloon. Okay. Now I'll slowly pull on the catheter until I feel resistance. Now that that's done, I will secure the catheter to the patient's leg and then hang the catheter below their bladder. Okay. All right, now I'll just start cleaning up. And then I'll also perform perineal care again. Okay. Now I throw everything away. I'll make sure the patient gets their call lights, that they're covered up. I'll document everything. I'll document what color the urine is, that it was a 14 French catheter, that how they did during the procedure, and everything over here would go in the garbage. I'd wash my hands, and that's it.